Okay, I'm doing a video about HRT, and this one, estrogel, and this one, utrogestan. It comes in the little pills like this that are a bit smaller than a pig. I've spoken about these in other clips that I've done, but my point today in this clip here is this. So that is just for the pump dispenser, and then we've got the other one. This is the leaflet, obviously, that comes in the packet. Oh, won't even fit in the shop, just about. So I'm a short person, I'm 5'3", and you know, I'm up at the top of my deltoid here, and that's going to to the bottom of my fingers, just going to there, from my deltoid to there. So I don't know about you, but when I open up a prescription packet and I get a leaflet that long, it does worry me. I've mentioned in another clip that I've had prescription pills before. I'm just going to bring this a bit more forward. Ooh. Right, I mentioned before in another clip that I've just touched on briefly that I haven't had a prescription for 10 years, and it's very scary for me to take a prescription drug because I had some serious side effects and allergic reaction basically to the last stuff that I was prescribed. It's got nothing to do with hormones or anything. It was off-label epilepsy drug for anxiety, and I can't quite remember. I'm going to have to go through my medical records if I can find what it was that I had a reaction to. I'll put it in the description below. It's not kind of relevant to this unless people are being prescribed it, which actually my neighbour is going through perimenopause at the moment, and she's on something like gabapentin. I'm not sure if that was the one that I had. I'm going to have to go through my medical records. I requested my medical records like from the age of 12 to up until whatever it was when I got them several years ago now. Yeah, there's a lot of information here that you want to read through. What you need to do before you take it, warnings and precautions. So do not use it if you've ever had breast cancer or you're suspected of having breast cancer, cancer which is sensitive to estrogens. So unexplained vaginal bleeding, excessive thickening of the womb lining, endometrial hyperplasia, in brackets that's not being treated, blood or vein clot, blood clotting disorder. If you've recently had a disease caused by blood clots in your arteries, such as heart attack, stroke or angina. Liver disease. If you've had a blood problem called porphyria. I've never heard of that. It was a rare genetic disease. Or allergic, hypersensitive to estradiol or any ingredients in the medicine. Reams and reams and reams of it. Basically, hang on, what's this? Tell your doctor if you ever had any of the following problems before you start the treatment. Well, surely a doctor should be asking you this before you take the bloody stuff in the first place. Fibrosis, womb growths, blood clots, again, cancer. It's just very repetitive. High blood pressure, liver disorder, diabetes, gallstones, migraines, or severe headaches, a disease of the immune system that affects many organs. So systemic lupus, whatever that says, SLE, lupus basically, which is like where your immune system attacks your body, a bit like what's that one, MS, that's where it attacks the peripheral nerves, isn't it? But that can also be B12 deficiency. So if anyone's listening who's been diagnosed with MS, go and get your B12 levels checked and ask why you're not being given B12 injections. Right, stop using it immediately. This is the important part. Any conditions that they've mentioned there, do not use. Yellowing of your skin or whites of your eyes, so jaundice, which means your liver's backing up. Raise in your blood pressure, Headache, tiredness and dizziness. Well, I get all those anyway, but normally my blood pressure's low, so to be honest, I wouldn't know if if that was happening to me. I wouldn't know. So migraine-like headaches, which can happen for the first time. So yeah, that's really important. If you start getting the really, really bad headaches just out of the blue, I'd say within a few hours to a few days of taking it, then go and speak to your doctor. If you become pregnant, well, that's a no-brainer. If you notice signs of a blood clot, such as painful swelling and redness in the legs, sudden chest pain, difficulty breathing. So I've got a chesty thing at the moment, but I know it's nothing to do with this because it's something to do with my muscles here and my right lung. It's probably biomechanical and just something in my lung. So yeah, that's very important about the swelling of the legs and the redness of the legs. So I mentioned the previous prescription from 10 years ago, the off-label epilepsy drug, and possibly some SSRIs. I'm not quite sure what they were. It was something that was meant for anti-anxiety. I don't think it was an SSRI because I tried loads of them over 15 years. Oh my God. That was over 10 years ago. I'd come out of a difficult relationship and my whole body just locked up basically. My trapezius muscles were up to my ears up here like this. I went to an osteopath. She said, your shoulders are the highest I've ever seen in anyone in the past few years. So that was great. And that was down to the stress of a very toxic relationship and the fallout of the damage that I've done. So that's a whole other video right there. Not really related to HRT. Right, so yeah, all about blood clots, veins, swelling, stroke, heart, all that stuff. Look out for that. So the capsules, these ones. Here's the list. Can you see me? Probably not, because it's so massive. Oh wow, so it tells you what it is, what you need to know. Yeah, I was talking about cancer again, breast cancer and all this stuff, stroke, heart problems, right, any of the same, it's the same thing again, but this one talks about eyes. I don't think, oh, I didn't do the side effects on that one, I'll come back to that. This is just the warnings that we're doing. So, yeah, all the stuff, obviously read it 2 or 3 times before you start taking it with any medication, even a paracetamol. Have a look at the side effects on there, which I don't take paracetamol. I haven't taken one of those for over 10 years as well. Right, so this is a huge progestin. The possible side effects: breast cancer, abnormal breast growth, blood clots, heart disease, stroke. Okay, now this is the bit that gets up my nose. It says here, frequency not known. It seems to me like they're evading the science, or however you want to look at it. Stomach pain, nausea, tiredness, headache, drowsiness, dizziness, vaginal bleeding, intense itching, which is pruritus. No. What? Yeah, pruritus. Yeah, so you get the, well, skin crawling sensation. I mean, you're going to want to take an antihistamine if you get that, and then obviously read the side effects of the antihistamine as well. Frequency not known, again, bloating of the stomach, depression, breast tenderness, hot flashes, vaginal discharge, joint pain, urinary problems. Got all that anyway, got all of those. Got all of that. So the following side effects have been reported with other HRTs. Gallbladder disease. Doesn't say, it just says frequency not known. I mean, how can you trust these people when it says frequency not known? So do they know? Have they done tests? Surely they must have done tests. There must be some numbers of, you know, it normally says 10 in 1,000 people have this or something. That is a red flag to me when they have things like that on the leaflet. So yes, fluid retention, breast pain, weight changes, increase in sexual desire, depression, rashes, urticaria. So that's my point about the other ones that I had. I first noticed the urticaria. It was a red rash down the legs, and then my legs swelled up and went black with the other stuff, not the HRT. If you're just picking up on this video halfway through or skipping through, important to listen to these kind of videos all the way through. I know it can be a bit rambling and disjointed. So these are the side effects that have been reported that I'm still going through. Fever, so you have the urticaria, patchy brown, dark skin, discoloration, fever, insomnia, alopecia, which is hair loss, irregular menstruation, and lack of menstrual periods. Well, you're going to get all that with menopause anyway. To me, most of those are menopause symptoms, apart from the urticaria and things anyway. Yeah, I mean, discoloration of the skin, pregnancy patches, cloasma, painful reddish skin nodules, erythema, nodosum. I mean, where are they getting these names from? Is this Latin? I mean, you can even say it. There's an important part on here about the MR. Where has it gone? Oh yes, MRH yellow card. Yeah, important part about the MRH yellow card online if you do have any problems. Well, is anyone doing that? Because why is it frequency unknown? You know, frequency not known. Frequency not known. That seems like very elusive, evasive language to put on a side effects medication to me. No, I don't like that. That, as I say, gets up my nose. Right, back to the gel, because I forgot to read out the side effects for that. Abnormal growth, cancer, stroke, blood clots, dizziness, headache, itching, same as that one basically, but it seems to be a bit less because, I don't know if it's because it's a gel or there's less ingredients or it does less, but they're both hormone replacements, so why is there slightly less information in the gel? Who knows? Wind, vertigo, migraine, mood swings, increasing the volume of the uterus, vaginal yeast infection. Oh, lovely! So you can get candida with a gel. How can a gel give you candida? I don't get it. Feeling of weakness. Well, I've got all that anyway. All of it. Get all that. Okay, so how are you going to know? When you get all these symptoms, most of these symptoms anyway. I mean, I'd sometimes get urticaria. I haven't at the moment. Down my legs. I had idiopathic urticaria for years. So how are you going to know? How can you tell? I mean, if you're taking other prescriptions as well that have got the same side effects on the list, then how are you going to know? I think this is the best thing to do is just jot it down in a diary or get a notebook specifically and just write it down, you know, the day and any possible side effects or any feelings that you have, or in a journal. So I keep a journal so I make note of everything. But yeah, I keep a health journal. That's a good idea, isn't it? Get a health journal and write it down. Don't obviously be completely paranoid and meticulous about it. Write down every sort of heart flutter that you have. But if those heart flutters that you're having increase, particularly say at certain times of the day or within a few hours of taking any of this stuff, this medication, then obviously make a note of that and then go and speak to your GP. So these are my thoughts. Just be very, very careful when you do take anything. And like I say, the specious kind of, not specious, not the word. Is that the right word? No, probably not the right word. So like I say, when you do take anything, read the label, read front and back, read it, reread it again, make a note of the side effects, get a highlighter pen, highlight all the side effects, make a note in a journal or a notebook of what's happening to you, because if anything does happen and you have to have time off work, you might not be covered, you might not be able to get any compensation. So that's something to keep in mind, especially if you're self-employed like me. Obviously I don't get sick pay, I don't get holiday pay, nothing like that. And this is my mission, to help other people like me who are going through these confusing, scary times with their HRT and their body changes, and just, yeah, be vigilant of what's happening to your body and all the side effects, potential side effects, and any changes in your body or your mood or anything like that. Just make a note of it, and obviously speak to a GP or a health practitioner, even a menopause specialist if you can find one, especially probably, what are they, gynecologists, or just a women's doctor? Yeah, gynecologists are for women, but I know there's ones that specialise in menopause. It's probably isn't. There, there's a chart on the Red School website in the book that I was reading. It looks something like this. So you can, not a lot of space in there actually for you to write stuff, but I guess you could blow it up a bit more on your printer, but then it's got to fit A4, hasn't it? So yeah, I mean, who's going to write in little boxes like that? That's you know, it's only for like 3 words. You can only write 3 words in there, so get a notebook. Be careful with what you take, and when you take it, make sure you take the right dose, or if you don't want to take the full dose that they recommend, that's up to you. As I say, in my other clips, I've not started with the full dose because I don't want to shock my body, and just because it scares me taking prescription drugs. And yeah, I'm just doing what I think is right for me, and that might be completely different for you. Obviously get medical advice from somebody. I've got quite a low BMI anyway. I'm like 8 stone, under 8 stone, so, and I'm petite. Tolerate prescription drugs very well. Certainly when I've had the pill and things like that. What's that shot they put in the arm for women? Is it Depo-Provera, something like that? I had that like 15 years ago maybe, and that was horrendous, or 20 years ago, I don't even know, but it was horrible. I didn't have a period for 18 months and I was just a mess on that. Contraceptive pills didn't agree with me whatsoever. I couldn't take those. So to be honest, I'm not expecting this to work for me. For me personally, it might be different for you, somebody else. Yeah, just be careful, make very detailed notes. Do the yellow card if you do get a severe adverse reaction like the urticaria especially, and the jaundice, any yellowing, things like that. Obviously jot it down, and please do report it to help other women as well, because so many people don't. We've seen a lot of that in the past few years, with people rolling their sleeve up and then not reporting anything and just thinking, oh, you know, oh well, it's just one of those things. No, no, no. Don't put anything in your body without reading everything, researching it before you take it. Just be so careful, and take care.